We can move on to the next topic. The next topic is infratemporal fossa. Infratemporal fossa, as you can see by the name, it is the one that is below the temporal bone. Infratemporal fossa. It is also known as parapharyngeal space. It is also known as lateral pharyngeal space. When talking about the skull, we are talking about the same thing. Let's look at its boundaries. Let me set up a few things here. Just one thing. Okay. If you have been with me from the last lecture, we use this model when talking about the muscles of mastications. So let's remove a few things. Let's remove a few things and see where it gets us. I am removing this temporalis muscle, buccinator muscle, masseter, little pterygoid, two heads. Let's remove them and let's remove mandible itself. Let's remove medial pterygoid and stylomandibular ligament. Okay, it brings us to here. There is removal of the yes. Okay, let me get back to the presentation. I think it will be simpler here. Okay, boundaries. Um, 1 minute. Let me set up the tensor. Will I give me a minute? I will set up a few things and then we will continue from here. Okay, just a second. You have been so patient with me. Just one more second. Okay, I am taking you back to the skull, the 3D model of the skull. Let me get it back. Okay, so here we are, the same model of the skull, the same area that we discussed before. So here let us see the bony landmarks. So this is the area that we are going to define. Let me show you by the markings. This is the area that we are going to define. This area is the infratemporal fossa. Infratemporal fossa. This is the infratemporal fossa. Let's make up the boundaries of this area. Okay. When we look at the front, this is the front, anterior aspect. Anteriorly, it is related to this bone. This is the maxillary bone. This is making the anterior end of the infratemporal fossa. If you climb up this bone and get to the upper aspect, you will see this opening right here. You will see this opening. This is the inferior orbital fissure. This is known as inferior orbital fissure, and this is basically the lateral aspect of inferior orbital fissure. You can see from the here also, here you are looking into from this point onwards. From there you are looking to the infratemporal fossa, and you can see the same opening all the way from the back. This is the here you can see the inferior orbital fissure. So this is the anterior wall, maxilla, the posterior aspect of maxilla, and superiorly the gap between the maxilla and the greater wing of sphenoid, and this gap between these two bones forming the infraorbital fissure. Let's trace the medial wall. The medial wall from front back, it consists of a little of the maxilla. Then there is this is the major bone that is on the medial aspect, that is called the medial pterygoid plate. A little point at the lower end. This is the pyramidal process, and then there is no bone in the back. There is a muscle that is called superior constrictor muscle. I will show you right here. So the superior constrictor muscle is making the floor here. Not only that, on the top of it, there is a set of muscles that is called, there are two muscles, both are going to the palate. There is tensor villi palatini and there is levator villi palatini. So these are the muscles that are on the this is all of the structures that are present in the medial aspect of the pterygopalatine fossa. We saw the maxilla, we saw lateral pterygoid plate, the pyramidal process, the two muscles going to the palate, tensor and levator villi palatini, the superior constrictor, and it ends back at the level of this styloid process. So this brings us to the posterior end. Styloid process is the posterior end. Below, it does not have a very clear boundary. It goes and becomes continuous with the neck. And superior aspect, it is the same as we talked about in the temporal fossa. So superiorly, we have this part. Superiorly, we have this part, number one. Number two, this part. These are medially. This is the greater wing of sphenoid. This is the part of the temporal bone and the suture between them. Then at this margin here, this is the infratemporal crest, point number 3. Let's look at them. This is the roof of the infratemporal fossa, and lateral to them, the fourth point will be the this zygomatic arch. This will be the fourth point, zygomatic arch, all the way to the here, and the fifth point will be the gap that is present between them. That will be the fifth point. So these are all the structures that are making the roof of the infratemporal fossa. Almost the same structures those were making the floor of the temporal fossa. So this is about the infratemporal fossa boundaries. Let's get back to the presentation. So here you can see medially it is made up of lateral pterygoid plate, tensor villi palatini, levator villi palatini, and superior constrictor, and there is maxilla in front, and there is pterygomaxillary fissure. Okay, I did not show you that. Let me get back to this. So this is this space, this one. This space is called pterygomaxillary fissure that is going into the pterygopalatine fossa. Laterally aspect, there is the ramus of the mandible cut here, covered with the muscle, that is medial pterygoid muscle, and on the upper aspect there will be coronoid process. Roof, medially, it will be made up of greater wing of sphenoid, the squamous part of the temporal bone, the suture between them, and the infratemporal crest. The laterally, it will be zygomatic arch, and between them, there will be the opening that communicates the two fossae, the supratemporal and the infratemporal fossa. In the terms of contents, it's a very big topic. It contains the deep part of the parotid gland. The part by the deep part here, I mean the part that was passing behind the ramus of the mandible and in front of the mastoid process and going inside. It contains that parts of the parotid gland. It contains 3 out of the 4 muscles of the mastication. The 2 muscles that were discussed here, the medial pterygoid with its 2 heads, the lateral pterygoid with its 2 heads, and the inserting last portion of the temporalis. Coming to the coronary process. Of course, masseter muscle is outside. There is arteries, maxillary artery and its branches. There are a lot of branches of maxillary artery. We will be going through them in this lecture. These are about 15 branches of the maxillary artery, about 10 in the infratemporal fossa, about 5 in the pterygopalatine fossa. And then there are nerves. There is mandibular nerve with all of its branches. Accompanying it, there is otic ganglion. Coming from the middle ear, there is cauda tympani, and there is from the pterygopalatine ganglion, there is coming out of nerve that is the posterior superior alveolar branches. Let's look at them. We talked about the muscles, 3 muscles, the arteries. I will go through these branches again. I'm not going to tell you the branches in this particular slide. The veins, these veins are not as well defined as the arteries. They sort of jumble up into forming a large plexus known as pterygoid plexus, and it is connected to the skull above, it is connected to the face and orbit in front, and it is connected back to the retromandibular vein through maxillary vein. The point to be remembered, it is present around pterygoid muscle, lateral pterygoid muscle. We will discuss that. And then there is veins, a lot of veins. There is a branches of the mandibular vein, there is otic ganglion, there is cauda tympani. Let's jump into them one by one. Okay, ignore this picture. This is our first topic, maxillary artery. First, let's discuss where is the maxillary artery, where does it originate, where does it end. When talking about the name of the artery, it originates from the point it bifurcates from the bifurcation of the external carotid artery. This is one of the 2 terminal branches of the external carotid artery. So it originates within the substance of the parotid gland as the external carotid artery divides into the superficial temporal and the maxillary arteries. It moves all the way through the infratemporal fossa. It crosses the lateral pterygoid muscle, and then the muscle is removed right here and it enters this pterygopalatine fossa, this particular part, this region. It enters pterygopalatine fossa, and it is giving branches all the way. We will discuss the branches immediately after discussing this, and then it enters the orbit as infraorbital artery. That it enters the orbiter at infraorbital artery. So this is where the name ends. So the maxillary artery name started right here when it branched from the external carotid artery, and the name ended here when it enters the inferior margin of the orbit, so infraorbital fissure. So this is the maxillary artery. It is divided into 3 parts. Let's discuss that infraorbital artery first, get it out of the way. Infraorbital artery, it's the continuation of maxillary artery. It runs in the floor, it enters the infraorbital canal, and it comes on the front of the face through the infraorbital foramen, and we saw that in the arteries of the face. So this is the infraorbital artery. Let's discuss about the maxillary artery and its branches. The maxillary artery, it's divided into 3 parts. The part 1, that is from the origin to before the lateral pterygoid muscle. So this area, from the origin to before the little pterygoid muscle. The part 2 that is going across the lateral pterygoid muscle. The artery may be running lateral to this and medial to this, and different atlases have made it differently. Netter's atlas I'm using right now, it has made it lateral to the lateral pterygoid muscle. The Grant's atlas, the one that is present in the Keithel Moore, that is present in the Moore's clinical anatomy, it has drawn it medial to the muscle. So don't get confused by that. It is a normal variation that it may be present on either side. And the third part is one that after crossing the lateral pterygoid muscle, it is inside the pterygopalatine fossa. That is the third part. So there are three parts. Each of the three has three set of muscles, three set of branches. Sorry for that. It has three parts: before the lateral pterygoid, at the medial pterygoid, after the medial pterygoid, that is the pterygopalatine fossa. Each part has five branches. Five branches. An interesting way to remember is that part 1, five branches go to the bony foramina. They all go into the opening of the bones. There are five branches. Number 2, second part, they all go to the muscles. Part 3, they are in the pterygopalatine fossa. So we will read them about in that topic, pterygopalatine fossa. Here I will be discussing about these two set of 5 and 5 branches. The 5 branches going into the bony foramina in the first part, and the 5 branches going into the muscles. So here the first part. The first part, a major artery shown right here, it is going down into the jaw, into the mandible, that is the inferior alveolar artery. It moves down, enters the mandibular foramen, run along the inferior alveolar nerve and run along in the canal to supply the lower teeth. And it has a branch that comes out, the mental artery. From the mental foramen, it comes and exits out and supplies the area in the chin. This is one branch. To see the other branches, we have to go deeper. There are two branches, you know their name very well. You have read about the skull, you know about the foramen of the skull and the structures that are passing between them. These are the true branches that are going to supply the meninges. There is middle meningeal artery right here, and there is accessory meningeal artery right here. They are opening into these foramina. The middle meningeal artery was entering the skull through foramen spinosum, and the accessory meningeal artery, it is entering the skull through foramen ovale. So we are done with three branches. We have done inferior alveolar artery. We have done inferior alveolar artery that was going into the mandible. We have done this one that was going into the mandible. We have done two meningeal arteries, the middle meningeal artery and the accessory meningeal artery. And this is the point of interest of an exam. Look at this point, it is running between the two roots of auriculotemporal nerve. So this question is very interesting and asked when talking about the auriculotemporal nerve, the mandibular division of trigeminal nerve, or when talking about middle meningeal artery. So this question gets asked. And then we are left with two branches, branch number 4 and 5. These are the branches that will go to the ear. These are the branches that will go to the ear, number 4 and number 5. One will go to the anterior aspect of eardrum, one will go to the posterior aspect of eardrum. So there is the one that is going to the anterior will be the anterior tympanic, because it is going to the anterior aspect of eardrum. The one that is going to the posterior aspect, its name, it's a little different, that is deep auricular artery. It is present deep in the external auditory canal, external auditory meatus. I know it's too much, but just for the sake of completion of notes, I will mention that they enter the openings. Through which openings? So the anterior one, it is entering through this fissure between the petrous bone and the tympanic part, that is petrotympanic fissure. And the one that is going on the back aspect, shown here, it is moving between the squamous part and the petrous part, temporal part. It is called squamotympanic. So here they are both entering the parts. So here we are done with the first part of the maxillary artery. Okay, let's dive into the second part. Let me clear all the ink on the slide. The second part. The second one part we talked about, it was supplying all the muscles. So which muscles were there in the infratemporal fossa? There was lateral pterygoid, there was medial pterygoid, and there was inserting point of the temporalis muscle. So let's supply these muscles. The muscle supplying the lateral pterygoid, artery supplying the lateral pterygoid, the artery supplying the medial pterygoid right here. Simple. And the two arteries supplying the temporalis muscle. They go through that opening and they go to the temporal fossa to supply the temporalis muscle. So we have covered 3 out of the 4 muscles of the mastication. We have covered the lateral pterygoid, we have covered the medial pterygoid, we have covered the temporalis. We are left with which muscle? We are left with mesenteric muscle. The artery that supplies the mesenteric muscle, it's shown here in the cut section. The mesenteric artery, it moves to the lateral wall just above the upper end of the mandible ramus through the mandibular notch between the coronoid and condylate process. It moves through that notch and enters the deep aspect of the masseter muscle. Here the cut end is shown here. This is the mesenteric artery. That's it. We are done with the second part of maxillary artery. When discussing the second part, just think about it is supplying the muscles. Which muscles? Think about the muscles of mastication. Just remember these names and you will fill the complete list. The two branches are going to the temporalis muscle. There is a branch going to the lateral pterygoid. There is a branch going to the medial pterygoid, and there is a branch going to the masseter. That's it. That's simple. So congratulations, you have completed one of the most difficult topics regarding the arterial supply, the maxillary artery. Okay, maxillary artery, its relationship to the sphenomandibular ligament, it's asked sometimes, as it moves from the parotid gland to the front infratemporal fossa. It is near the neck of the mandible, in the upper part of the ramus of the mandible, between the mandible on the lateral side and the sphenomandibular ligament on the medial side. And sometimes you are asked the questions, which structures are related at this level? So superiorly it is related to the auricular temporal nerve, and inferiorly it is related to this inferior alveolar nerve. So this is the question that gets asked sometimes. The nerves, there will all the same branches will be present. There will be the two branches coming from ear. There will be two tributaries coming from the anterior and posterior aspect of the tympanic membrane. There will be tributary coming from this inferior alveolar nerve. There will be emissary veins coming from the foramen spinosum, foramen ovale, especially through foramen ovale. And there will be all the supply back from the muscles, or 5 of them, and they are not very well defined as arteries, but they will joined to form a plexus that is called pterygoid plexus. It may be present inside or outside the pterygoid muscle, and as you chew, the pterygoid muscle expands and contracts, not exactly with when it contracts, it shortens its length, its belly swells up, and then this pterygoid plexus is pushed and released, so it acts as a peripheral pump, just like you talked about peripheral pump in the lower limbs when talking about the veins around the soleus. So it's a peripheral pump. It is connected everywhere. It is connected superiorly to the cranial cavity, and the sinus is there. It is making its connections through to the cavernous sinus, through foramen ovale, through foramen lacerum, and even through foramen spinosum. The connections are going. Anteriorly, it is connecting to the orbit, the infraorbit ophthalmic vein. It's connected here. It is connected to the veins of the nose through sphenoparietal foramen, through palatine fossa, and through this vein, the deep facial vein, it is connected to the veins of the face. That brings us back to the danger area of the face. This area is connected through ophthalmic veins to the cavernous sinus, and lower area it is connected through the pterygoid venous plexus to the cavernous sinus. So this is about the pterygoid venous plexus. Then we are going to discuss the mandibular nerve. Don't worry, I will discuss the especially the mandibular nerve topic. The mandibular nerve topic I will discuss again with the trigeminal nerve, and I will trace all of its division with its branches. But let's discuss it here also. My focus will be to identify the nerves and to see where does they go in the cranial nerve. In the component, I will be focusing also on which components like parasympathetic fibers are going there, only sensory and motor fibers are going there. So I will be discussing that in the cranial nerves, but let's focus on the cranial nerves, which can be seen right here. So the mandibular division, it is coming down from the middle cranial fossa into the infratemporal fossa through this opening, foramen ovale. It has it as it exits, there is a main trunk, main, then it divides into the anterior division, and it divides into the posterior division, and we will see the branches of them separately. There will be three branches from the main trunk, there will be three branches from the posterior division, and I think there will be three or one from the this region also. Let me consult my notes very quickly so that I don't record anything that I would regret later. So there will be three branches from the there will be branches from the main trunk. Let me open my notes. Give me 1 second. There will be branches on the okay. Let's talk about the main branches. I like the mnemonic. Like you taste something funny or something tasty, you said, mmm. So this is the mmm. This is the mnemonic for the main trunk. So the main trunk, this gives rise to a mandibular branch, and it gives rise to a nerve that is going to the medial pterygoid. It giving rise to the this meningeal branch and the nerve that is going to the medial pterygoid. This medial pterygoid you won't be able to see it from the lateral aspect. You have to dive into the medial aspect. So here it is shown here, medial pterygoid nerve, this one. It is the one that arises from the medial aspect of the mandibular nerve. It passes through the optic ganglion and it supplies nerve, medial pterygoid muscle. Apart from it, it will supply the two muscles which have a name tensor in them, which have the name tensor in them. Which are the two muscles? Tensor. They have both have names tensor in them. There will be tensor villi palatini and there will be tensor tympani. The muscle that is supplying the tensor of the palate and the nerve that is supplying the tensor of the palate. So it is basically the branches of this nerve, the branches of the nerve that is coming from the medial pterygoid nerve. So here you can see actually the nerve that is going to the tensor villi, tensor tympani, the nerve going to the tensor villi palatini. It is shown right here. They may arise as a separate branches, but they usually arise from this parent nerve, that is the medial pterygoid nerve. That is medial pterygoid nerve. So we just discussed the main branch, the main trunk of the mandibular nerve. The mnemonic I discussed was mandibular main trunk has meningeal branch that goes back through the foramen ovale and supply the area, and sometimes it does rise in the higher up in the meningeal area in the middle cranial fossa, and it does not have to go up. And the second one was medial pterygoid nerve that is supplying the medial pterygoid muscle. Along with it, it is supplying the two muscles which have the name tensor in them, the tensor villi palatini and the tensor tympani. So this is the anterior, this is the main trunk of the mandibular division. Okay, let's move to the anterior. Anterior is the one that has mostly, I am using the word mostly, muscular. Again, what was the muscles in the infratemporal fossa? These were the muscles of mastication. Have we covered any muscles of mastication in the main trunk? Yes, we have covered the medial pterygoid. So what we are left with? We are left with three muscles. We are left with temporalis, we are left with lateral pterygoid, we are left with masseter. So let's find them. Again, the word mostly I used, there is one sensory nerve also. So this sensory nerve would be the one that is a sensory supply, that will be the buccal nerve. Let's follow these nerves and let's find these nerves. Okay, the one that are going to the temporalis muscle, these are called temporal nerves, anterior and posterior. The one that is supplying the lateral pterygoid nerve, it's a very small nerve, it's originating and just supplying the muscle, that is pterygoid nerve. So we did deep temporal nerve, we did lateral pterygoid nerve, and then the third motor nerve is shown in the cut section right here at this point. This is called masseter nerve. It will go laterally, it will go over the mandible, it will go through the mandibular notch, and it will supply the mandible that is outside the ramus, the masseter that is outside the ramus. That is the masseteric nerve. Three muscles. Then we are left with the fourth nerve, that is the sensory nerve, that is the buccal nerve. It will be covering the surface of the buccinator, and please don't be confused, it is not the motor nerve supplying the buccinator, it is the sensory nerve supplying the top of the buccinator area. So it exits the infratemporal fossa by moving between the two heads of the lateral pterygoid, and as it moves out, it goes to the lateral aspect of the cheek, it runs over the surface of the buccinator and supplies the skin over it, and it penetrates the muscle to supply the mucosal membrane on the inside. So there are four branches we discussed. One of them was sensory, three of them were motor. These were a pair of temporal, these were masseter, these were lateral pterygoid, and the sensory one was buccal nerve. Okay, there are variations. Sometimes the two temporal nerves arise independently. Sometimes the second temporal nerve arises as a part of buccal nerve. Sometimes the lateral pterygoid nerves arise as a part of buccal nerve. Sometimes one of the temporal and the masseter nerve arise from a common tree. So these are the different things that we just discussed. So we are done with the anterior division that was mostly muscular. It has one sensory supply nerve and all of them other was motor. Then we are left with posterior division. If we said that anterior division was mostly motor, we will say that the posterior division is mostly sensory. Again, the word mostly is there. So it has three branches. You have read the names already. One is auriculotemporal, the other is inferior alveolar, and the last one is lingual. Don't worry, we will be discussing them again when talking about these in the cranial nerves, but let's follow them here also. Auriculotemporal nerve. It arises from the posterior aspect. This is a very important thing to remember. It is arising from two roots, and these two roots are embracing the middle meningeal artery. They go back, curve around the temporomandibular joint, and they move up in front of the ear opening just behind the parotid gland, and supply goes up. It supplies the parasympathetic, sympathetic, and sensory supply to the parotid gland. It supplies the sensory area to all of this temporal region. Let's keep it aside now. So we have just talked about auriculotemporal nerve. Let's talk about now the lingual nerve. It is not very much included in this topic, but we have to discuss it, the chorda tympani nerve. I'm not, I don't want to discuss in detail the root of the chorda tympani nerve, technically speaking, but I will give a very quick summary. Chorda tympani nerve, it's a branch of the facial nerve. We're talking about chorda tympani nerve, it's a branch of the facial nerve that has gained access to the middle tympanic cavity, middle ear, and from there it enters anteriorly petrotympanic fissure. Through petrotympanic fissure, it is coming into the infratemporal fossa. It is very important because it is carrying the fibers for the taste of anterior two-thirds of the trunk, and it is carrying the fibers from the salivary glands, the two of them that are remaining, that is sublingual and submandibular gland. So carrying these fibers, the taste and parasympathetic fiber of salivary gland, it enters the infratemporal fossa and it merges with the lingual nerve. Before the merging, the lingual nerve, the trigeminal nerve is the lingual nerve was purely sensory. It was going to supply the general taste sensation to the anterior two-thirds of the tongue. But due to this chorda tympani, it is now having the fibers of the parasympathetic fibers to the salivary gland, and it is having the special fibers that are going to sense the taste. So that is how the lingual nerve is gets to carry all of these fibers. So lingual nerve, it moves down, it supplies the two glands. There is a ganglion here, some mandibular ganglion just above the ganglion. It is hanging from the gland. We will talk about the connections of the ganglion in the cranial nerve section, and we will talk about it in the oral cavity a little bit, and it goes on to supply the oral cavity. So it supplies these two glands, submandibular, sublingual glands, and it supplies the tongue through the fibers that were originally coming from the trigeminal nerve. It will be supplying the general sensations, and through the fibers that are coming through chorda tympani, it will be getting the taste sensation anterior two-thirds of the tongue. With the last nerve, we are left with the last nerve, that is inferior alveolar nerve. This is the only nerve that has some motor component. It has some motor component. This motor component separates early on as the inferior alveolar nerve itself. It enters the mylohyoid. It enters the mandibular opening and mandibular canal in the ramus of the mandible just beyond, and it continues to run inside the mandible and supplying the teeth. Its cutaneous branch comes outside as mental nerve, and its other branch continues onwards to supply the lower teeth. So this is inferior alveolar nerve. But you can see before it enters the canal, the bony canal, it gives rise to this nerve. That is the nerve to mylohyoid. That is the nerve to mylohyoid. So this is the motor component. This is the only motor component of the posterior division. It goes down, and as you can see, it is going to supply the mylohyoid muscle. It is going to supply the mylohyoid muscle and the muscle that is just superficial to it, that is the digastric muscle, anterior belly. So this is all about the supply of the anterior division of the trigeminal nerve. So that brings us to the end of the discussion of the mandibular nerve. We talked about its main trunk giving rise to two branches, the meningeal branch and the branch to the medial pterygoid. And in the medial pterygoid, we added the two muscles with the name tensor in it, tensor villi palatini and tensor tympani. Then we discussed the anterior division. We talked it was majorly muscular, supplying the rest of the three muscles, that was lateral pterygoid, temporalis, and masseter, and one sensory supply, that was buccal nerve, that was sensory nerve. Then we talk about the posterior division, that was majorly sensory, having the auriculotemporal nerve going back and above to the front of the ear to supply the parotid, temporomandibular joint, and the temporal region. The inferior alveolar nerve going down into the mandibular canal, supplying the lower, all of the lower teeth, and giving out this mental nerve. But before going so, it was giving out a motor nerve, that was mylohyoid nerve, that is shown here. And in the last, we talked about the lingual nerve that received the chorda tympani, and after gaining the superpowers from the chorda tympani, it went on to supply the anterior two-thirds of the tongue and the two of the three remaining salivary glands. So that brings us to the end of the infratemporal fossa. Okay, the last topic but not the least. You have bared with me for so long. I really thank you for that.